In this video, we will be seeing the esophagus. Esophagus, can you see this muscular tube 25 centimeters in length, and it starts from, you can see this projection, this is called thyroid cartilage. Just below that you have the cricoid cartilage. So your esophagus starts from the cricoid cartilage. So cricoid cartilage lies just opposite to the lower border of C6, cervical 6 vertebra, or upper border of C7. So anything can be fine. So number one is cricoid cartilage. Here is your pharynx. Pharynx continues as esophagus. So this junction is called as pharyngoesophageal junction, right? Now the the esophagus starts and it enters in the superior mediastinum. At the level of the sternal angle, it comes and lies in the posterior mediastinum. So first it lies in the superior mediastinum, then in the posterior mediastinum. The four constrictions of esophagus are: number one constriction is at the junction called pharyngoesophageal junction, and the second at the level of the arch of aorta. See esophagus, you can see the esophagus nicely here. It is crossed by number one. Okay, you can see the tracheal bifurcation, that too in the left bronchus is exactly on the esophagus. Number three is arch of aorta, you can see nicely the constriction. So the first constriction at the pharyngoesophageal junction, number two constriction at the arch of the aorta level, number three constriction is at the tracheal bifurcation exactly over the left bronchus is constricting on the esophagus. Number four is here the esophagus is entering into the abdomen and through the diaphragm. There is an opening for the esophagus. That opening is called at the level of the thoracic vertebra level 10. So you have to know the measurements also. From the incisor teeth is here now, from the incisor teeth, the first level pharyngoesophageal junction is at the 15 centimeters. Then the second arch of aorta is at the level of the 22.5 centimeters. Number three is the tracheal bifurcation, that to left bronchus is at the level of the 27.5 centimeters. And the last one is when it enters into the diaphragm, that is at the level of 40 centimeters. Then it enters into the junction with the stomach called gastroesophageal junction. So this end is called as gastroesophageal end, where it enters into the stomach. These are the four constrictions of esophagus, and the esophagus is supplied by the vagus nerve. You can see the vagus here, right vagus, that is the left vagus. You can see the right vagus here. So both the vagus nerves you can see clearly. This supplies the esophagus. Okay, right and left vagus are here, right vagus is here. Since the left vagus is here, it supplies the esophagus, right? Okay, fine. This is about the esophagus and the clinical application. Four constrictions for the endoscopic procedure. It is very important. The four constrictions, so you have to be very careful while introducing the endoscopy. And then the upper margin and lower margin of esophagus also, esophagus is supplied by the esophageal branches. Esophageal branches of which artery is nearby? Descending aorta or thoracic, descending thoracic aorta. So this gets its supply from the branches, from the esophageal branches from this artery. And then veins are esophageal veins. Esophageal veins, the lower esophageal veins, upper esophageal veins, they will be draining into the azygos vein. Okay, hemiazygos this side. And then here lower esophageal veins will be going down into the stomach. It will be going towards the stomach, esophageal veins. And then last one is lymphatics. Lymphatics will be going to the thoracic duct, and this side right lymphatic trunk. This is about the esophagus. And then now you see the thoracic duct. Thoracic duct, initially you have to be very careful while reading the thoracic duct. Thoracic duct you could see nicely. Here is your thoracic duct. What I am holding, it lies first, it is a continuation of cisterna chyli. It enters into the abdomen through the aortic opening at the level of VOA. V for vena cava, O for esophagus, A for aorta. So this esophagus pierces the diaphragm at thoracic level 10, I said already. So the aorta will piercing the diaphragm at the level, diaphragm at the level of 12, thoracic vertebra, T12. So it enters into the abdomen. Cisterna chyli is the one which is present in the abdomen. From the abdomen, cisterna chyli pierces the diaphragm through the aortic opening. It enters into the posterior mediastinum. So this is the thoracic duct. Immediately it lies in the posterior mediastinum between what and what? Between the azygos. You can see this is the azygos and this is the esophagus. So it lies between the azygos and esophagus on the right side. So right side, now I am seeing the course here. Right side it goes up, it lies between these two structures, and then it goes up between the azygos and the esophagus. Nicely you can see. and it is going up and it enters and at the level of the T5 it crosses, and it is going towards the left side. T5 level it crosses and goes to the left side. It lies beneath what? Arch of aorta. It lies beneath the arch of the aorta. You can see here it lies beneath the arch of the aorta, and then you can see arch of the aorta, it comes and it lies beneath the left subclavian artery, and then only it enters into the neck. So you have to write the relations of arch of aorta and left subclavian, because it lies beneath the arch of aorta and left subclavian, and then it comes here and it enters into the thorax. Enters into the neck just above the clavicle it enters, and the junction of the subclavian, you can see the vein present here. So subclavian vein and internal jugular vein, it drains into that. That's why left supraclavicular nodes will be enlarged. The enlargement of the left supraclavicular node is called as Virchow's node. The enlargement is called as Trocheus sign. Only the left side will be enlarged, not the right side. So right head and neck portion, right lung, right liver, right side, nothing will be drained into the thoracic side. Only the left structures will be draining into the thoracic duct. And if there is any tumor in the GIT, in the abdomen, through the intestinal lymph trunk it will enter into the cisterna chyli. From the cisterna chyli through the via the thoracic duct it will enter into which supraclavicular? Left supraclavicular. So only the left supraclavicular nodes will be enlarged. That is called as Virchow's node. And the next one structure is azygos. So azygos already I have explained. Azygos vein is formed by ascending. You will be having a lumbar vein in the lumbar side on the abdomen. From the ascending lumbar vein joins with the last vein, that is called a subcostal vein. So subcostal vein joins with the ascending lumbar vein and forms the azygos vein. Azygos vein enters into the thorax, posterior mediastinum, and you can see the azygos nicely here. Okay, the azygos tributaries of azygos are formation tributaries, means what are the two veins they form the azygos? Ascending lumbar vein and the right subcostal vein. These two you have to write. Along with that you have to write about all the intercostal veins. From which to which intercostal vein? 5th to 11th intercostal veins, can you see nicely? You can see the drainage of azygos. The posterior intercostal veins 5 to 11 drains into the azygos. What about other veins? First intercostal vein drains into the brachiocephalic. You can see the brachiocephalic vein here nicely, so it will straight away enter into the brachiocephalic. Second, third, fourth, you can see here. You can see nicely second, third, fourth intercostal veins, they form the superior intercostal vein. The superior intercostal vein may enter into the azygos or to the brachiocephalic, superior intercostal vein. So the second, third, fourth forms the superior intercostal vein. Only 5 to 11 straight away it enters into the azygos. You can see nicely it crosses the sympathetic chain and it enters into the azygos. This is your glistening one is your sympathetic chain. So this is about the right side. Left side, what happens? Left side you will be having same type of posterior intercostal arteries. Here also the first posterior intercostal artery will be draining into the superior intercostal and brachiocephalic, and the second, third, fourth will be draining into the superior intercostal vein, and 5th, 6th, 7th, 8th. Okay, these 4 veins they drain into the vein called as ascending accessory hemiazygos. What is this called? Accessory hemiazygos. Rest 9, 10, 11 will be draining into hemiazygos. How the hemiazygos will be formed? The same thing. Left side ascending lumbar vein joins with the left subcostal. Here also you have the subcostal node that forms the left hemiazygos. That side right azygos, this side left hemiazygos. So hemiazygos veins draining into the hemiazygos are 11, 10 and 9. 5, 6, 7, 8 will be draining into accessory. So this side you will be having accessory hemiazygos and hemiazygos. This is hemiazygos, this is accessory hemiazygos. These 2 veins they will cross the midline and they will be draining into the azygos vein. How do they cross? If you see here, they cross at which level? Hemiazygos crosses at the level of T8. Accessory hemiazygos crosses at the level of T7. Both of them they cross the midline and goes and drains into the azygos. This is about the azygos vein.